Nurses must be valued and committed partners in making policy, directing and evaluating clinical care, and leading organizational operations. We implemented a standard of a delirium protocol in the pediatric ICU. We recognized that there was a need for it, and so we started it as a project. We had identified what we thought to be some patients with delirium in our ICU. And we talked with one of our physicians who was very familiar with delirium, especially in the pediatric ICU. And it was identified that this could possibly be something we're seeing, and that we realized we kind of had a need to educate not only our nurses about delirium, that there was kind of a knowledge deficit, but also our physicians as well. So in order to achieve these goals, we initially did a preliminary assessment with all of the staff nurses and the physicians, kind of to establish what everyone's knowledge base was for identifying delirium as well as treating delirium. So we did an initial assessment with that, identified the need for both nurses and physicians, that we definitely had a knowledge gap that we needed to fill. So then we made a committee. We got a group together that included RNs, assistant nurse manager, and a physician. And we worked to develop a delirium protocol, which included a scoring tool and also a treatment plan. We decided to develop an interactive module, which everyone was required to do during our annual mandatory education online. And the interactive module had education that had a lot of case studies, which after everyone did, the nurses said was very helpful to actually utilize the information on case studies versus just answering questions. And then now that we are in a better spot with COVID and we're able to meet in small groups, we are going to, for our PICU Skills Day, we're working on doing a delirium escape room and trying to develop that so that our nurses can kind of utilize the information and do an escape room. The delirium protocol empowers us as bedside nurses because it gives us the ability to not only assess for delirium, but then to actually have a protocol to go to physicians and pharmacists and say, you know, my patient is experiencing X, Y, and Z, and I truly feel that this is what they're experiencing. Follow the protocol. There are some things initially on the protocol that the nurses can do themselves. And then from there, like medications and stuff that the physician can do. Sometimes we say, I think this patient's having delirium, but I'm not sure. And then the physician's like, I don't think so. But this allows us as nurses to say, no, look, they meet these requirements and we need to do X, Y, and Z. So that's really nice. We were able to identify multiple patients during actually this whole project and after that, using our scales, these patients were experiencing delirium that maybe we wouldn't have caught before. And then a lot of the nurses and especially physicians felt a lot more comfortable with using the scales and identifying this and then knowing what to do and what to stay away from to help these patients to treat them. I would say it's definitely worth going and following through and taking the time to finding something that could help in the work environment, getting a team together, making a plan, and then following through because it's the best way to make change and to help with the work environment.
Each of the 6 healthy work environment standards includes a list of critical elements. In this project example of effective decision-making, Kaiser Permanente ensured that nurses are in a position to participate in all levels of decision-making. Nursing staff saw a gap in practice when it came to pediatric delirium and worked to fill it. They did so by collaborating with the appropriate departments and healthcare teams to facilitate data-driven decisions to create their delirium algorithm and protocol. All members of the care team share accountability for effective decision-making by acquiring new skills, mastering content, assessing situations accurately, sharing fact-based information, and communicating clearly and inquiring actively. They do this each day by leading interdisciplinary rounds and making patient care recommendations.